Hello everyone, I hope you all are good, doing well. So today is the 6th of January 2025 and today we are covering again one of the most important theme of UPSC and other state PCS competitive examination, and the theme is health sector in India. The theme itself is a very vast, so I cannot promise or I cannot say that I have covered all the sector. In the health sector itself I have covered each and every corner. Rather, I tried to touch each and every sector and I have tried to focus on the theme what was given in the Hindu newspaper today. And apart from that, I have given you certain information which might be helpful for you in the prelims examination, and I have given you I will give you the idea like which kind of a question has been asked and what is the possibility to be asked in the coming like examination or in coming paper. So this lecture is being represented by me. My name is Shama, and the first and most important thing, as I always emphasized, we should look after whatever we are reading. That topic should have its connectivity or relevance in our with our preparations. So the most important thing you can see here, where we can use this theme, like in the paper GS2, especially in the main syllabus, social justice, governance and welfare scheme. So if suppose there is some scheme of government, like we have seen Pradhan Mantri Jan Dhan Awas Yojana or Ayushman Bharat Yojana. So that is scheme, and what is the impact of that scheme on the population of India. So this kind of a question has been asked already. I will guide you further what to focus and what not to focus. In the paper GS3, we can say economy and science and technology, how we can use like if suppose government has been allocating some kind of a budget, some kind of amount in the budget or economic survey towards the health sector, what would be its impact and what all it's going to cover, how India is going to tackle the aging population. So this all and with its what is the percentage of GDP India is using in health sector. And if I talk about the science and technology, there we can see what all new vaccines has been developed. UPSC has asked after COVID who has developed the role of organization in COVID and how COVID has impacted Indian population in prelims and mains. In prelims also the factual question was asked, and in mains the analysis and the impact of COVID has been asked on the population, and what would be the scenario and how the future economy will be going to be shaped because of the COVID. So that was kind of a question which has been asked. And recently, if you guys are following newspaper, we again now we are seeing certain kind of a virus is being like we are getting the news to be like the virus has developed in China. So let's see how impactful it would be. So if it be in news and it had certain kind of impact, so there is a possibility or that UPSC or other state PCS examination is going to ask that questions. Further, we can see the essay theme. So here you can see like health is a wealth. That is one of the very basic thing we all know. Like if you are healthy, you can earn wealth also. And the most important wealth of a human life is your health. How healthy you are, that decides everything. Next is healthcare as a fundamental right. I have connected this topic in the GS paper 2 also, like in governance, social justice I have said. So we are going to see certain article of polity, especially fundamental right and DPSP, how they are connected with that. Like I have given you in prelims relevance also. Apart from that, you can see here the case study. In ethics paper, we can see this kind of a health related issue and the case study. Like recently we have seen what happened in the West Bengal with one of the uh, practitioners, or I could say one of the doctor. So what kind of a situation, if suppose you are going to be an district magistrate or you are going to be SDM, how you are going to tackle that kind of a scenario, how you are going to face the public outrage, and how you are going to tackle the government also. So this kind of a situation is something which we can see if there is a possibility of questions in the ethics paper. The next point we can see that its relevance in the prelims, like article 21 and of fundamental right and article 39, 42 and 47 in DPSP. And if you guys could remember this article, well and good. If you cannot remember, I request you to go and look after your notes or your Lakshmikant if you are referring to it, or if you're referring your Bear Act book, so you go and refer it. If I talk about the current affair, whatever scheme would be in the news, you have to focus on it, especially related to health sector. The next, innovation in science and technology, that has been asked in UPSC. I have emphasized above also, so that's all. And the next, like I have given some point where we can focus, like if suppose WHO has started certain scheme. I remember in the UPPCS examination the question was on the WHO WASH scheme. So this kind of a question has been asked. And SDG role, yeah, SDG, you all know SDG is Sustainable Development Goal, which we are supposed to achieve by the year 2030. So like SDG goal of 3, in most of the time we have seen, especially in prelims of UPPCS and UPSC, like which number of goal has it connection with the its connection with the which sector. Like I think in this year also in UPPCS the question has been asked related to SDG. So this is the article which we are having today in the newspaper. I have just taken the screenshot. I have highlighted the important point here. I don't know whether it's visible to you or not, but I'm damn sure that you all are having your newspaper, so you can just highlight this point which is relevant for you. So the most important thing which I could say here, and this is for the prelims perspective, sorry, just a second. I don't know why I'm not being able to use this. So this point, if you could see, this is something which is very important. And why it is important, like that, if you could see the title, it is saying India's need to prioritize preventive care. So here they have, like I have also the newspaper and I have highlighted also here. So what it has given certain kind of a screening investigation or the equipment through which the screening is done for certain kind of diseases. And there is a high possibility that in prelims you can see this kind of a question, because UPSC has asked already, and even state PCs has asked this kind of a question. So I'm just gonna read it out. Like if there is a question like mammograms, for like use of mammogram is done for what? So that is used for the breast cancer screening. Pap smears for cervical cancer, X-ray and low dose computed tomography for the lung cancer, ultrasound for liver disease, and echocardiography, that and treadmill stress tests for the heart disease. So this kind of a sample, like this kind of a question has been asked in previous PCS examination and UPSC. So I request you all to focus on this point, like what all kind of a screening device which we use or the name of that. So that is important. Apart from that, if you guys can see, this part is the path of way forward is also important. And in that you can see what they have suggested. They have suggested how we can mitigate by preventing the disease. So like as far as I remember, in the year 2023 also the question has been asked, like India always focus on the curative measure rather than focusing on the preventive measure. So this was the question. I cannot recall the whole question, but there was this type of a question was there, and then they ask it is A is true or A is explaining the R. So assertion and reasoning type of a question. So if you go through the prelims previous year question paper, you guys will see that kind of a topic. So without further delaying, what we are going to see here, the first important thing is a public health. What is a public health? You can use this definition as it is in your mains, and you can write it in a notebook also. Like it is the definition which is given by the WHO. And public health it's not only about that to prevent the disease, rather it also include how we can promote health, how we can promote life among the people, population as a whole. So its aim is not only about focusing to prevent the diseases, rather its aim is also to focus on the entire population, how they could be healthy in long term. Sorry. The next important line which I could tell you here, that 7th of April every year we celebrate as a World Health Day. So that is something which is observed by the WHO, and the theme which I have mentioned here, it was of the year 2024 itself, and the theme was My Health, My Right. So this kind of a question already has been asked in the prelims of PCS and UPSC others examination, like World Health Day has been celebrated on which day and what was the theme of that day. So this you can memorize or you can just keep in a mind. And in the year obviously 2025, if you are going to give, so again on 7th of April we are going to have certain different theme. So just be vigilant and be aware about, like this kind of a question has been asked, and there is a possibility of this kind of a question in future also. Apart from that, I have given certain factual information which you can write in your notebook, and that will help you to enrich your mains answer. Like Indian medical value travel market size is around 5 to 6 million, and it's going to expand around 13 billion in by the year 2026. So this is something which we can you can use in your mains answer writing also. So what is a health sector in India? What it comprises? So I have written here, the health sector in India comprises of hospital, medical service, clinical trial, outsourcing, telemedicine, medical tourism, health insurance, and medical equipment. So health sector is not only about the hospital and medical devices, it is also about that health insurance, medical tourism, and telemedicine. So there is a certain more information which I have given here, like that you can go through only, that's not much important. So I'm moving further here. So let's focus on right to health in India. So as I have already told how we can connect this topic with our GS paper 2 with governance part. So here you can see Article 21, which is a part of fundamental right in which we are given the right of life and personal liberty. So here also it includes right to health. No doubt it is not included explicitly, rather implicitly it has been included right to health also. Apart from that, if we look after the DPSP part 4 of Indian Constitution, in which Article 38, 39, 42, 43 and 47 that talk about socio and economic justice, and how it's going to, like, directly or indirectly, this article relate to public health policy in term of health. And there's another, like I have given certain Supreme Court judgment also, and their cases also. Supreme Court in Paschim Banga Khet Majdoor Samiti case in the year 1996 has said the primary duty of government is to secure the welfare of people, and being an obligation of the government to provide adequate medical facility for its people as a welfare state. So somehow you can connect this point also to the article part of fourth part of Indian Constitution, that is DPSP, in which we talk about the welfare state, especially Article 38 itself talk about. So this is how you can use this case in your mains answer writing. Apart from that, the another point which I have given, Parmanand Katra versus Union of India 1989, in which Supreme Court again said the government hospital, like Supreme Court ruled that every doctor, whether at government hospital or in a private or provision, like in a private hospital, they have this obligation to extend his service and due expertise in promoting life. So it's not like you have, like Supreme Court has always been very you could use this example or this cases in a judicial activism also, like how judiciary is trying to enter into the domain of executive and legislature. So this is one of the good example which you can use in the GS paper 2 also, if there is a question of judicial activism, and you can use in the GS paper 3 also, and the same you can use in your AC paper AC and ethics also. Apart from that, human dignity, that I have told that in Article 21 we talk about the personal liberty, and human dignity is somehow like right to health is an essential component of human dignity, and it should be promoted not only among the individual regardless of their promoted among the individual regardless of their health, gender, caste, religion, socio-economic status. If I talk about the international convention that you can use again in your mains answer writing, that is something which will help you to enrich or get more marks, like UN Declaration of a Human Right in the year 1948, which has been issued by UN, United Nations, and India is a signatory to that of Article 25 of Universal Declaration of Human Rights. So you can use this thing, like we are signatory to Article 25 of Union Declaration of Human Rights signed by India, and we should, in order to we have signed, and in order to be obliged and in order to follow that, we should provide a standard of living condition to our people, and that include not only food, health and housing, but also the medical care and necessary social service. So these are points which you can use in your mains answer writing. So here first I would like to focus on the evolution of Indian sector, and that I have written here, like what was the condition of India during the pre-independence time, and what was the focus of India during the post-independence time and the present day. So if I talk about the pre-independence time, and if you guys are like I hope you guys have gone through the history of India, especially the modern history part, where you can have seen that every time we have faced certain kind of epidemic, and that was one of the reason why India was not the population of India was not growing enough, and even the population was there, they were not healthy enough in order to face this kind of epidemic or in order to live a healthy life. And apart from that, what all initiative has been taken by colonial rule, that is not something that was not adequate, because they don't wanted to invest their single penny on the Indian health infrastructure. The next we can see in the post independence time, and in like after we get independence, or we were in the journey of getting independence, and there was a one committee which has been established in the year 1946, and that is the Bora committee, in which we have seen what all recommendation it has done. And like the recommendation was very much related to the relevant, it's relevant even today, like we have to focus on the public primary health sector in the rural area especially, and we have to focus on the preventive care. That was the recommendation of Bora committee. We have to focus on access to care. So this is something which is relevant today also. Apart from that, we have seen in the 5-year plan, government has focused on the public health infrastructure, and they established aims. They established, like if I talk about government medical institutions and university, so that was the plan in the 5-year plan of government. Apart from that, we have seen like we have eradicated certain disease like polio eradication, that was done in the year 2014, and we have eradicated smallpox also, and we have run this universal immunization program. So this was something, the step which has taken by the government. If I talk about the present day, that is like the disease burden of diseases has shifted from the communicable to the non-communicable disease. There's a, what is communicable disease? The disease which is spread with people. Like if I talk about the COVID, that is a kind of a communicable disease. But if I talk about the heart disease, that is not a communicable disease, that is something non-communicable disease, or you could say genetic disease. So, and in present day focus is on the like TB. That is one of the focus of government. The non-communicable diseases like heart attack, heart diseases, and focus on the level of cholesterol, BP. These are something which is being too dominant, and like 1 in every 4 people, they are suffering this kind of a diseases. Apart from that, the next focus of today's present day is like universal health coverage, in which we are not focusing only like to provide the quality of health services. Like we are trying to focus on, it should be given to each and every people, and it should include preventive care also, it should include rehabilitation thing also. So this is something which we are providing in the universal health coverage. The next point is healthcare infrastructure, and no, sorry, I have missed this point also. Like this question has been asked in the UPSC also, like how we calculate maternal mortality rate, and how we calculate infant mortality rate. And if you talk about if you see that IMR is counted per 1,000 live birth, and if I talk about MMR, it is calculated per lakh live birth. So you just need to be a bit focused, like when it is IMR it is 1,000, and when it is MMR it is on the per lakh. So there's a certain information, it is a factual information which you can see, and the data might change in future, so I'm not emphasizing on this. The next thing which we have to see, that is the healthcare infrastructure. So we all know there's a two sector in healthcare. One is a primary, second is the private sector. And primary sector is something like, in primary sector also we can divide into further 3 subcategory. The primary health, public health sector we can divide, sorry, in public health sector and private health sector. There are 2 type of a sector in a healthcare. And if I talk about public health sector, that we can further subdivide into 3 category, that is primary health center, secondary health center, and the tertiary health sector. I'm sorry for the noise that is from upside. So in primary health sector, that is the first point where people get connected with the qualified doctor, and that is sub-center, primary health center. And in the second category, we see the role of community health center, and in the tertiary sector, we see the role of district hospital, medical colleges like AIMS and all will come into the tertiary sector. If I talk about the private sector, that is like they account 70% in the area, urban area, and 63% of rural hospitalization. So this is a kind of a thing which they are like public and private sector both are sharing in terms of a health infrastructure. There's a certain point which I have provided, like there's a very big divide between the urban and rural area. Only 30% of India's healthcare workforce serves in rural area. So there is a big gap, I could say, and this is one of the gray area which government need to focus. Like we have to establish a kind of a good hospital. I remember there's a, I don't remember, I think in my, even in my own village, there's we don't have any big hospital. Like if we need to go, we have to go to the district hospital. There's a no nearby good health, a good hospital, be it a private or be it a public hospital. And the next is medical tourism that we have to focus. Like India ranked is improving day by day, and now we reach to the 10th as per the medical tourism index. So we can focus on it. And how we can focus, like we are already developing a generic medicine, and the cost, the people who come here, they don't like, the burden on their financial burden is less in India. So we have seen a lot of people, a lot of neighboring countries, especially from the people from America and Bangladesh, they all uh, trust on Indian healthcare infrastructure and doctor. They all visit us, visit in our country in order to get care. The next we are going to see the challenges in healthcare. That is something which you can use in your mains answer writing again. Accessibility, obviously there's a, I have given you the recent, like in the last slide only, I have given you the data. Like in rural area we are not having much health sector infrastructure, limited penetration of health insurance. That is one of the biggest point which we have to focus, and I think government is also focusing on that. And that is the reason government is running certain kind of like Atal health insurance scheme and all, in which people are given in health insurance. And the next is affordability, like high pocket expenditure. If you could have, if you guys have been with me in the last 3 video, I have talked about this also. Like as per the WHO, in India the high pocket expenditure of Indians are 63%. Here it's written 60, so it's okay. You might recheck it also. That is not that, it's like between 60 to 65% is what is our high pocket expenditure in health sector. And the next we can see like this the contribution from the GDP is not much, and I have given you further the factual information. Like if you see in the low health expenditure by government point, there you can see the neighboring country and the poor country. Like China has spent around 3%, Thailand 2.7, Vietnam 2.7, Sri Lanka 1.4, and if we talk about India, that is 1.5% of GDP. So hope we can hope that in future we are going to increase, we are going to see the increase in this expenditure from government side as well. And if I talk about the quality, the shortage of health worker that we have faced during the COVID time also, and poor infrastructure, this kind of a issue which we have faced in the COVID, you can use. And what you might have seen from your own eyes, I need not to tell you even that, and that point of health shortage in the health structure and all. There is an emerging concern, as as I have already told, that is like we are shifting towards non-communicable disease, from communicable to non-communicable disease, and that is something like diabetes, hypertension, and cancer. This disease is something which is creating a big havoc and creating a burden, financial burden on the individual also. And another one of the most important thing, and I think one of the most neglected topic which we don't talk when we talk about the health sector, that is mental health. We always talk about only the non-communicable disease, we talk about the communicable disease, but we hardly talk about the mental health care awareness, because we don't believe that we can mentally be ill. So that is one of the, but I'm like happy that recently we have seen a lot of actor and actresses, they have also came forward and talk about the mental health awareness. So let's see how government is going to use, and government is going to, and we as a like private sector can take care of it or not. Another point we can see, like violence against healthcare worker, that was one of the biggest challenge which we have seen. And the biggest example I have given you earlier also, that was of West Bengal, we have seen recently. That is something which shook everyone's from inside. So this is the challenges which we can see. Apart from that, profit driven pharma sector, yes, it's very true, private sector is profit driven. If you visit, like it's like you can experience it if you visit any private hospital, the kind of a doctor fee, and like they will always, that would never be less than 1000 rupees. So that is something which is profit driven pharma center. And if I talk about population density and demographic, like the size of India is growing. India is being one of the most populous country in the world, and so that is one thing. Another thing is like aging population is something which we have to keep in our mind while formulating our policies. And apart from that, we have to also think of that increase in the chronic diseases. So that is something where our focus should be shifted. Next, we can see the lack of diagnostic service and public-private partnership issue. That is also another point. And one health approach for emerging disease. We cannot treat, or we cannot treat every disease with one approach. So we need to have multiple approach in order to tackle another different kind of a problem. Like in order to tackle communicable disease, we should take a different approach. In non-communicable disease, we should take different approach. In order to tackle the mental health diseases or awareness, creating awareness, mental health issues awareness, we need to take the different approach. So this is something which we have to focus. Key government scheme and program. I have not listed on many. I have just focused on few, like Ayushman Bharat, in which we can see the health and wellness center. That is another thing. Target, we can see here the National Health Mission. That is I have included. Mission Indradhanush. That is one of the important topic, and it has been asked in previous year prelims question paper also, full immunization coverage. And the next is Rashtriya Swasthya Bima Yojana. That is something which is talking about the insurance related issue. And PM Swasthya Suraksha Yojana, that is another point. And PM Jan Ashuddhi Kendra, where we are distributing generic medicine at the very low and the cheapest price, I could say. And the next is Amrit, affordable medical medicines and reliable implants for treatment. So in order to provide medical equipments and medical device, we are assuring that the quality of medicine and medical device should be at the affordable price. Addressing obesity and mental health, that would be one of the, like, economic survey has also highlighted this point, like obesity. And we have seen that FSI has also run certain kind of a initiative in order to tackle this obesity issue. So what we can see here is something what all we need to focus and see. I have not written all the scheme, and that is not even humanly possible to memorize each and every scheme. Like so what I would suggest you, if you guys are preparing for the 2025, what you can see, like in last 6 months especially, not I won't suggest even for last 1 year, in last 6 months, if you are seeing some kind of a scheme which is being in the newspaper continuously, and if that there is some issue which has been covered in the economic survey or budget, so you have to focus on that scheme itself. So this is the kind of a way which we have to do a smart study. So this is how you will pick up this scheme and program and memorize that. The next we are seeing health sector, healthcare financing in India. The condition of public spending is very low, that I have already included. Private sector, we can see the high pocket expenditure, and insurance scheme, that is something which we have covered already. And there is a one more thing, like emerging trend and innovation. So what all we need to cover, like what in 21st century, what we can see, what we can use in order to provide better health infrastructure facility or better healthcare facility to our people. We can take the health of digital AI. We can take the help of AI. We can take the help of telemedicine platform like Sanjeevani. We can take the help of AI and robot, like how their robot are being used in order to have surgery and all. We can use focus on preventive healthcare like yoga, Ayurveda, wellness tourism. So this is the point, like where we can develop our soft power also. It is like, if you guys have gone through your IR paper, you can use this point in order to develop a soft power, like developing India as a soft power. So these are all things which we can use when we wants to be as a soft power in global scenario. Then we can focus on the public private partnership in order to provide better health facility. Apart from that, this is the way forward which I have provided here. Like what all we need to do, we need to adopt the technology, we need to improve access to healthcare. And this study, the lesson study, you can use in your mains answer writing. Like India has been ranked around 145th among 195th country in terms of quality and accessibility of healthcare. That is a one gray area, and we need to focus on it. And we are lagging behind in terms of our neighboring country also. We have to focus on improve health outcome, like early detection, treatment for non-communicable disease, which we have to focus. The next we can see reduction in financial burden. We have seen that like how you can use whenever you write your challenges. I'm giving you one small tip. Whenever you have seen your challenges like higher pocket expenditure, poor health infrastructure, so you can use the same top point in your way forward also. You can say that we have to focus on the developing public health infrastructure. We have to focus on providing more percentage from GDP to the health sector. We can improve our health access facility. We can improve our public-private partnership. So how you can use your the written challenges in terms of way forward also. This is the one of the smart way in order to write the answer. Because humanly it's not possible to remember each and everything, but you can use this point in your mains answer writing, and while writing your mains as a key point. So whatever would be the challenges, you have to, like in way forward, you can pick up some certain point and you can tell like we need to improve this point. And like what I will suggest here, like you might have seen we have developed that medicine or vaccines, I could say, for the cervical cancer. So you should remember the name of that, who developed it. There's a possibility and high chance that UPSC or state PCS examination will ask that kind of a question. And there's a one more important term, that is antimicrobial resistance. Like we have seen how in India people are very I will say careless. They go to medical store and they ask like, we are having cough and cold, just give some medicine, and they don't like continue the till it's like the moment they feel better they stop taking medicine. So this kind of a thing is creating a different kind of a challenges, that is antimicrobial resistance. So we have to focus on this kind of issue also. So the next point, mains question paper. I have written certain question paper which has been asked already in UPSC. You guys can go through it, as the lecture is being very long, so I don't want to waste a lot of time. So this is the conclusion. That's all. Thank you from my side. I hope I have given some input. I might have helped you. I hope that I would have helped you increasing some kind of a knowledge. So don't forget to hit the like button if you like this channel. Do subscribe. Do let me know in the comment section if you want to improve something, and if you have any kind of a suggestion in order to improve the quality of video or something. That's all from my side. Thank you. See you soon.